Well, good morning, everyone, and welcome. My name is Mary Hogan. I'm a senior policy analyst here at the Federal Reserve Bank of Minneapolis on the Community Development and Engagement team. Um, Really excited to have the opportunity this morning to moderate our panel here about occupational licensing. The Community Development and Engagement Division research team has published a couple articles over the last year on occupational licensing. First, on how occupational licensing um, has really limited access for jobs for workers of color. And later, we just recently published an article about occupational licensing and how it's impacted immigrant communities and some of the barriers there. Really excited to have the opportunity to have a broader discussion today about the current state of occupational licensing and ideas of where states can move these processes forward from an economic and an equity level. So I'm very excited that I'm joined here by a very knowledgeable group. Starting on the end, we have Tamar Frolichstein-Appel from Upwardly Global, an organization based in, is it San Francisco or she's out of Chicago?
We're national. We have
Mhm.
offices in San Francisco, New York, Chicago, and the DC area.
Awesome, thank you. Next, we have Suzanne Hultin from the National Conference of State Legislatures. And then we have Morris Kleiner here from the Humphrey School of Public Affairs at the University of Minnesota. And lastly, we have Rebecca Allensworth from the Vanderbilt School of Law in Nashville, Tennessee. So thank you all for joining this morning. I'm going to start with you, Morris, just to get set the stage here. You just edited a volume that features studies of licensing across countries and professions. It's a really wide group, wide-ranging topic. To get us focused on the conversation today, I'm hoping that you could tell us about groups that are sometimes poorly served by licensure and those rules as they currently exist.
Well, first of all, thank you for the opportunity to be here and to speak to this group. It's always great to have both academics and practitioners dealing with the issue. And as sort of the basics, occupational licensing has grown from about 5% of the workforce right after World War II to about 1 in 4 workers that require permission from government in order to work for pay, which is the basic definition of occupational licensing. And unlike many other legislation or laws, it is really state by state that governs occupational licensing. And the book that I recently co-edited with Maria Commenta, who's at the University of London, deals with some of the international aspects of licensing, but also really focuses on what licensing does to consumers. So does licensing provide any benefits, that is either quality or reducing risk? And we also look at the effect that licensing has on prices across 5 different countries and across a number of different services, ranging from pharmacists to Uber drivers. So there's a huge range of different occupations that we examine over time and across countries and across different industries. And so part of it is what happens to individuals who are trying to get into the occupations, and licensing serves as a barrier because you've got to take additional classes, do apprenticeships, engage in different internships, which serves as a barrier to entry. And perhaps not surprisingly, given sort of economics 101, is when you restrict supply, then prices go up, and who pays for that are largely consumers are one group, but also individuals who are trying to get into a wide variety of occupations. And it's not just the traditional occupations that you think are licensed, such as doctors and lawyers and dentists, but it's also mid-range occupations like plumbers and electricians, and lower income occupations such as barbers and individuals who are in beauty services who require permission from government in order to work. And that serves as a barrier for them to get into these occupations, given that they're trying to get into those occupations when they're fairly young. It serves as a barrier for them, and it takes a long period of time for them to recoup those investments. So and also it's time away from their current job and time away from family, which really restricts individuals' ability to get into those occupations, which is good for individuals who are in the occupations. It drives up wages, but it also drives up prices. And our book really looks at the effects that it has on consumers. That is, does it enhance efficiency, that in terms of do they get what they pay for, and are consumers willing to pay for those higher priced services which are being regulated? And generally, the name of our book is Grease or Grit. That is, does licensing serve in terms of machinery, making machinery or the labor market operate more efficiently, or is it grit in the machinery which serves to slow down that mechanism? And across the occupations and countries we look at, just to this is those of you who want to know the whodunit and read the last page of the murder mystery, is it tends to be more grit than grease. So it serves as more of a barrier relative to it making labor markets operate more efficiently. So those are some of the issues, and certainly individuals who are lower income and have less disposable income, it raises prices, but it's unclear that licensing serves to provide higher quality services, and there are a wide variety consumer welfare or consumer satisfaction is not enhanced, and measures that we look at for Uber drivers, which are measures of hard starts or hard stops, which are correlates of safety, and there was no differences between the more and less regulated individuals in these occupations. So that's sort of the overview of what we look at. If you want to get at this in more detail, it's available on Amazon and at the Upjohn Institute. And I think Aaron Sojourner will be here. He represents them very well.
Thanks, Morris, and thanks for giving us some spoilers for the book. Next, I would like to turn to you, Suzanne. The National Conference of State Legislatures, where you work, and its partners launched a big effort over the last several years to improve licensure policy nationwide. Can you tell us what you learned from leading these efforts and the state consortium efforts, and how states can learn from each other to improve licensure?
Yeah, definitely. Well, first off, thank you so much for inviting me here. As mentioned, in 2017, the National Conference of State Legislatures, along with the Council of State Governments and the National Governors Association, received some funding from the U.S. Department of Labor to work on occupational licensing, specifically work with states on reducing barriers to licensure and improve the portability of licenses across state lines. And so through the project, we convened 16 states and brought them together over a course of 3 years, where they met with experts, some of who are up here today, and really had an opportunity to work as state teams and set their goals, set what they want to work on specifically in their state. So state-led, and we saw a lot of movement out of the states. And I'd say we put together a kind of a final report of the consortium work at the end of 2020. And I just want to highlight some of the lessons learned that we kind of gathered from the group. And the first one was the importance of stakeholder engagement in the states. And we've been tracking legislation in the states introduced on occupational licensing. And through our tracking, we realized that states that were part of our consortium introduced fewer bills than states who are not part of our consortium. However, the enactment rate was 60% compared to only 40% of the states that were not in the consortium. So that led us to believe that the states that we were working with were doing a really good job on stakeholder engagement. We work with legislators, and so we find that sometimes conversations are had that don't include policymakers, and then bills are introduced, and there's no engagement with policymakers on why this legislation is important, and it ends up dying. And so we found that part of the consortium was really good at bringing those stakeholders together, not only the policymakers, but others in the state. Also, a lot of the states found that they needed to find ways to institutionalize their efforts. Obviously, when money is kind of handed down to states to work on big projects, leadership changes and things, end up kind of withering away. And so the states that were part of our group realized that it was really important to institutionalize the efforts, whether it was reform-minded or just evaluating the licenses in the states. And so some of the states did that through sunrise or sunset processes, or it could be just creating working groups that withstood leadership changes. We also learned, and kind of more specifically to your question, the value of peer-to-peer learning. The states, when we brought them in for meetings, they were out of the politics of their states and were able to hear from one another what was valuable, what worked, what didn't work, kind of what were the challenges when a certain state tried to implement a reform. And then they were able to go back to their state and kind of take what they learned from these meetings and see what they could do. And then finally, one of the other things that was really important was a third-party facilitator. And so the National Conference of State Legislatures and GACSG, we really let the states lead what they wanted to do. We didn't come in with an agenda, and that was really valuable to them because we know every single state, kind of the different politics on the state when it comes to licensing, they vary by state. So it was really valuable to have kind of that third party facilitator. So yeah.
Thank you. So turning to you, Tamar, one area that we here at the Minneapolis Fed think is very important is how licensing supports foreign-born workers. I mentioned earlier that we had published an article recently looking at some of the barriers that immigrant communities are experiencing with licensure here. It seems that there are clearly aspects with the current system that don't work well for immigrants. If you could tell us about your work on these issues, the effects of the current system on immigrants, and some of your views on how we can make it easier for immigrants to enter licensed professions.
Sure. So I'll try to keep this to 5 minutes. But
it's not a full day conference tomorrow.
So Upwardly Global came into existence with the idea that our refugee system, supports people for a very short time, and they often get put into what we consider survival jobs. So the founder of our organization was in a small town and went to a chicken processing plant and was introduced to the best workers, and they were engineers and doctors who had come as refugees. And she thought, this does not make sense. It does not make sense for our country, who needs doctors, engineers, accountants, IT professionals, teachers. And it doesn't make sense for these families who these people who went through extensive training and come with vast experience to be working in such a non-skilled field. So the system doesn't serve these folks well. And that's sort of how Upglow came to be. And I've been at Upglow almost 10 years now. And one of the things that we see, the idea that if you have skills and experience, once you're trained in how to create a US style resume, the importance of interviewing and networking, things that many of us who've grown up here really take for granted, but are very culturally based, will help many, many people get jobs. For folks in highly regulated professions and licensed professions, that's not the case. And I've worked in a lot of fields. I'm nationally the head of the healthcare team, so work with folks in all aspects of healthcare. But for sure, the area that I spend the most time is with doctors. And the process to relicense as a doctor is incredibly expensive, incredibly time consuming. And to make a very long story relatively short, you're judged on your year of graduation. So I'm working, with 40-year-olds who finished medical school 15 years ago, and they're certainly not old, and they're considered old grads. The system also, you're competing for residency slots nationally to become a doctor. There simply aren't enough residency spots. There are not enough spots, I think, right now for the folks who do finish graduate school. So the system is so wrong-headed for these folks. I work with, amazing folks who are coming, who were not planning to come to the US, who come from Afghanistan, come from Ukraine, come from Sudan, and the barriers to licensure are so rigid that for many of them, it's not a realistic path. And, we don't have enough primary care doctors in the US. We certainly do not have enough primary care doctors in rural areas and disadvantaged communities. So this is something that we as a country need to address. UPCO is part of some international, national coalitions working on this issue, working with various state legislatures. I can talk a little more about that, but the majority of my work is sitting with individuals and figuring out if it makes sense for them to try to go this pathway, to try to relicense, or are there affiliated pathways they can take. For many doctors, a pivot to clinical research can be a really satisfying and smart pathway because it's less regulated. It really takes advantage of their education and expertise and knowledge, their growth opportunities in clinical research, in academia, and in hospitals and in pharmaceutical companies. So that can be a really good pivot. But for many of them, they are continually stuck in very low wage positions that don't utilize their experience and their expertise. So we work really hard. Oftentimes when I meet a doctor, the first thing I'll say is the system is really broken, and I want to acknowledge that here. I'm here to help you in the system that is, but we're also working around advocacy efforts to try to change it. And many states are starting to acknowledge that. Washington State recently passed a law that allows doctors, internationally trained doctors who've passed USMLEs, to become limited licensed doctors. The states of Colorado, Massachusetts, and Illinois all have task force working around this, but it's something really, really essential for us all to be thinking about.
Yeah, absolutely. Well, turning to you, Rebecca, on a little bit of a different note, you have done a lot of work in your work with looking at licensing boards and how they operate and the problems with self-regulation, in particular with those boards. Wondering, with the Supreme Court decision on North Carolina Board of Dental Examiners versus the FTC, how are those issues of self-regulation on the state level being addressed, if they are? And has there been any movement recently?
Short answer, they're not. So North Carolina Dental, which was decided in 2015 by the Supreme Court, said that licensing boards that were mostly made up of active market participants, as in a nursing board made up of nurses or a physician board made up of physicians, needed to be supervised by the state. It was a recognition that these boards are not really governmental, that they need some additional. And these are volunteer part-time boards with actively working professionals, not just people with the experience, but 360 days out of the year, they're working in their clinic, and 5 days they're sitting on the board. That they need to have supervision in order to be immune from the antitrust laws. So as somebody who was really interested in boards and really critical of licensing going too far, I had read at this point a lot of Morris's work, for example. I thought that maybe North Carolina Dental would have this huge impact, and there might be a sea change in the way that we regulate the professions. Well, I looked at how many cases have cited the case since that time, and there's about 100 About half of them pertain to professional licensing boards. And the vast majority of these cases either avoid the issue, they say, that the case can't go forward on an antitrust theory, or the board is probably immune. There, with a couple exceptions that I'll talk about in a second, but maybe looking back, this was sort of inevitable that NC Dental would not have the impact that I had hoped for. First of all, it's very hard to make out an antitrust violation in the first place. So you basically could take half of what boards do, which is individual case discipline, and cut that right off of something that you could use antitrust to challenge, because getting rid of one doctor is hardly a huge competitive concern. The other problem is that if you do even have a situation where a board has done something that seems anti-competitive, you would get analysis under something called rule of reason, which is an antitrust rule that's very, very deferential to the defendants, in this case, the boards. So if you're able to surpass both of those things as a plaintiff, then you have to worry about this immunity question. And that's what the NC Dental case was about. Whether or not you get immunity, even after North Carolina Dental as a board, is very, very uncertain. That's because they haven't been clear about what active supervision really means. So this all makes it sound like North Carolina Dental has had no impact. That's not what I think. And that's in part because of these high profile cases that do find boards to be either not immune or potentially not immune, in other words, liable for antitrust violations. There's a couple of cases involving a company called Smile Direct, and there's a case called Teladoc, in which this is basically the holding. And I think that those cases, and also the uncertainty that I just identified on the part of plaintiffs, I don't know if I can bring this antitrust case, and so I'm not going to bring it, cuts both ways. I think the uncertainty for the states about whether or not their boards could be liable, especially with these cases now on the books, has caused some change in the way that they do regulation in order to prevent that possible suit from happening. And if what you're interested in is how boards actually behave on the ground in the face of the regulatory situation, including North Carolina Dental, then I'm a good person to ask, because I have spent the last 5 years going to licensing board meetings and interviewing licensing board members. I've been to almost 50 board meetings. I've interviewed hundreds of people, board members, people facing discipline, professionals, they're lawyers, politicians, law enforcement, board staff. And I can say, talking about what I've learned about North Carolina Dental, which is a very small subset of what I've learned, that it has had an impact. It comes up in board meetings. In a rulemaking, the lawyer sitting over here will say, don't do that, North Carolina Dental, don't do that. There are meetings in Tennessee are live streamed to the public, but also up to somebody, I know who named Laura Martin, who is the head of competition for the head of the sort of North Carolina Dental response. And she views what the board is doing and then intervenes if she feels like it's competitively sensitive. So on the margins, the shadow of North Carolina Dental maybe has had a small impact, but I don't want to overstate it. It has not been a sea change. We are still doing this regulation through the same kind of board that North Carolina Dental worried about, which is self-regulating, self-interested people. And if there's one thing I want you guys to take away from my talk today, it's going to be that we need to understand boards better. So organizations like NCSL is understandably very focused on the legislative side of things. What are the licensing laws that we are able to create or roll back? Labor economists are also very interested in statutes because they're easier to code. They're very important. I'm not saying they're not important, but you can look at statutory differences between different states and kind of measure their outcomes on workers and on prices. But to me, if we say then, okay, well, that's licensing, we understand licensing. That's like saying we know the law by like flipping through the federal code and completely ignoring courts, court decisions, the whole apparatus of where that law meets, where that rubber meets the road. And I can tell you that the things that North Carolina Dental was worried about, anti-competitive behavior, maybe things that are under the flag of antitrust, but as I pointed out, maybe aren't great antitrust cases to win, are definitely happening. I'll tell you a little bit about some of the examples that I saw. So I saw board after board go after unlicensed practice with zeal in their disciplinary decisions, sometimes increasing penalties where their staff were recommending dismissing it with a warning letter, and at the same time dismissing consumer complaints. A kind of disconnect between what the board is really kind of going after. I saw a debate about a rulemaking for increasing the educational requirements to become an alcohol and drug abuse counselor. And they voted to do that. And the justification was, in part, pay for our counselors in the trenches, in their words. I saw them be very harsh on immigrants. And that's an interest of this panel. I saw a cosmetologist from Michigan who could not pass the Tennessee test in English and would otherwise have been eligible for reciprocity from Michigan, except he had taken the Michigan test with an interpreter, which disqualified him from getting a license in Tennessee. I believe that he has just continued to operate on an unlicensed basis, which is incredibly common in the hair industry, and probably is being assessed regular $1,000 fines every year as a kind of tax. I saw a lot of that. Very little, they won't shut down your hair operation, but they will extract their tax for it. I saw the medical board propose limiting the number of nurse practitioners that one doctor can oversee to 4, which would necessarily set a cap on essentially primary care providers in a state that's rural and relies heavily on nurse practitioners for primary care. I call this part of the book locked out. Okay, and this is the part that I think North Carolina Dental was trying to get at. But there's also a whole other side to the story that I call locked in, which is all these measures are taken in the name of safety, in the name of quality. And then when it comes to the disciplinary side, they're doing nothing like what we would expect to see if they cared about quality and safety or if they had these issues on their radar. I saw drug dealers kept in practice, nursing board and the medical board. I saw sex abusers kept in practice in some of those boards. I saw grossly incompetent doctors and nurse practitioners kept in practice. One economist showed that you have to get 5 major medical malpractice payouts before you get a 30% chance of board discipline. So it's a problem of locked out and locked in. To me, the root of those things is the self-regulation. And as always, the people who pay the steepest price for this dysfunction are the disadvantaged of our society. So by slapping the wrist on these professionals, but not taking their license, that makes it hard for them to work in mainstream practice. They can't work at hospitals, they can't take health insurance. So what happens? They get funneled towards our more vulnerable populations. The cash clinics, the institutional employers where you don't have to have your own malpractice insurance, jails and prisons. You're 7 times more likely if you're a Suboxone provider in Tennessee to have board discipline. Now, there could be a few different reasons for that, but I think a big part of it is if you get major board discipline, here's a way that you can operate a cash practice without having to take insurance. That leaves our addicted population at the mercy of these providers. In Louisiana, the board actually uses a headhunter to connect its disciplined physicians with jobs in the prisons. 80% of the doctors in prisons in Louisiana have major board discipline for sex with patients and dealing drugs, and 100% at Angola, which, by the way, has the highest death rate in the US. So we need to pay better attention to where the laws that we have, which aren't great, as some of the research shows, are made even worse by funneling them through this self-regulatory apparatus. North Carolina Dental is not going to save us from this system that we have.
Thank you. Well, that leads me to my next question for both you and Morris, which sounds like it's kind of it's a loaded question now, 'cause I'm looking at how how these policies can be improved. There's so many components there, starting with Morris, in your research, you've argued that, occupational licenses don't necessarily improve health or safety, and it can actually have adverse effects on consumers when those restrictions inflict higher costs or, limited access. Rebecca, as you just mentioned in your remarks, state licensing boards are deeply entrenched in the existing system and create barriers and put vulnerable people at risk, as you just noted. From a policy standpoint, what structural changes are needed to put states on a better path to reform? I mean, when the problem seems so massive, where to start on the policy piece?
Well, a couple of things, and these are sort of related to the pandemic in terms of policy, that at the beginning of the pandemic, a number of states, including Minnesota, Colorado, and many others, relaxed their occupational licensing requirements for respiratory therapists and nurses. So that, for example, individuals who had graduated or just graduated from nursing school or respiratory therapy school could practice under a temporary license. Also, nurses and respiratory therapists who had retired and had not paid their fees to be a licensed practitioner could come back and practice immediately. So there was a lot of relaxation of occupational licensing requirements, which significantly increased the supply of practitioners, really under a battlefield commission. That is, the governors allowed these individuals to practice during the pandemic, but only for a limited period of time. And only Massachusetts has allowed these practitioners to become licensed, fully licensed, after the pandemic, so that the opportunity to work in these occupations has been limited after these spikes in demand for these individuals. So perhaps learning what happened following the relaxation of occupational licensing might be an important issue. Looking at states like Arizona, which has allowed individuals to come to that state and practice almost immediately. And again, this is subject to board restrictions. There are certainly boards do dominate in many cases, but the statute says they can move to Arizona, and 8 other states have quasi relaxed their restrictions in terms of moving to those states to allow individuals to practice. And Arizona is touting the increase in the number of practitioners in those states, that is, number of practitioners and number of practitioners per capita has increased as a result of the relaxation of occupational licensing requirements. So a part of it is just studying, see what's happening, certainly in terms of the supply of practitioners, relaxing entry requirements both from new graduates and people who may want to come back to the occupation, and interstate mobility. All those are ways of increasing the supply, and if Econ 101 still works, increasing access and reducing prices.
So I agree with all of that. I think that universal recognition laws like Arizona's are, in a perfect world, the way this would be done. I think that probably at a political level, it's hard to imagine that being adopted by every state universally. But to me, it doesn't make any sense that you're fully licensed to practice in one state. Why shouldn't that be a license to practice everywhere? I think that's right. But again, bringing it back to boards, I do think that this illustrates the problem. Arizona is a great example. So Arizona created this universal licensure recognition thing. And there is language in there that says something about substantially similar, if the education is substantially similar. Now, anytime you have something like that, which is probably necessary politically to get the bill through, there's somebody who has to be deciding what is substantially similar. I was at the NCSL conference in Vegas a couple months ago, and a member of the board of, I think it was psychology in Arizona, came up to me and she said, "Oh, I know that law. Well, we decided that this state wasn't substantially similar because, you know, it required had a lesser educational requirement or whatever." That's what I worry about. I worry that if we take reform, if we take as a given these dominated part-time boards, which are functionally associations. Most of the people on the boards are members of their association, are steeped in that ethos. They're often past presidents of the association. If we do all this really important, difficult, meaningful work at the legislative level, and then we just take as a given that the apparatus that we have down here, it's not going to work. And so what I think needs to happen, I mean, my book is called Bored to Death. So you probably are going to guess that I think that we should get rid of professional licensing boards. For a lot of professions, this can and move the implementation of these licensing laws for the professions that we need them, which I think is fewer than we do now, into state government in a meaningful way. So Tennessee did this in a small way for, well, they kind of abolished the license for locksmiths, but we have one licensing system for burial services and we have one licensing system for funeral directors. Funeral directors is a dominated board. The burial directors is run by the assistant commissioner. He is on his own as a full-time bureaucrat employee, understands regulation, interested in regulation, not a burial, not a cremator, which is basically, you know, well, I guess it's cremation and also literally burial. He runs the program. And if you're a cemetery, you go lobby him, show up to the meeting, that's fine, sunshine and everything, lobby him, but he's the decider. So how can we, so for many of these professions, you could have a similar commission run program. For some of the more complicated professions, we may want to have something that looks like an advisory board. We have something called the air quality control. I can't think of any other area of state government, by the way, where we hand over regulation to a quasi association like this. So if you asked, you know, a board full of polluters, what do you think the air rules should be? You would get one thing. Instead, what we do is we have a board of 2 polluters, 2 environmental advocates, a professor at a school, 2 mayors. Okay, that's the air quality control board. Similarly, we have a board called the Elevator and Amusement Ride Board. I think that's probably my favorite board meeting that I've been to. You've got the COO of Dollywood on that board, but you also have, you know, like a children's advocate on that board, right? Mm-hmm. By statute, they are required to be balanced by the various, to use a word that gets used a lot in this space, stakeholders, right? Mm-hmm. Who are the stakeholders? It's when you go to a licensing board meeting, the stakeholders are always the professionals. And I just want to argue that there's a lot of other stakeholders in professional regulation, and they need a seat at the table. Even better, make that board advisory to an assistant commissioner.
So Suzanne and Tamar, you know, in addition to some of the policy solutions that Rebecca and Morris just offered, what are some ways that workers can be supported in going through the existing licensing structure? Have you seen any states that have done that particularly well? Wanting to get your thoughts on that.
So one thing I wanted to just chime in, because I was really interested when Morris talked about the COVID rules. So many states, after the initial bout of COVID, tried to create rules for international medical grads to get doctor's licenses. And as I understand it, and I am not a researcher, but they were very, it was very limited success. And what I can say, in the state of Illinois, as we started advocating around this issue, we work very closely with the Illinois Department of Professional and Financial Regulation. They're a great partner to us. So we started working, and then one day they created we don't even know what to call it, a permission for internationally trained doctors who pass the USMLEs and have ECFMG certification to practice under a licensing doctor in the state of Illinois. So great, except nobody works under this because hospitals and clinics will not hire people. They don't, it's as long as there's a COVID emergency. So if anyone can tell me how long that's going to be, hospitals cannot get these folks malpractice insurance. They don't know the scope of work. They're over, I believe, 300 people who have this. We don't want to call it authorization. We don't quite know what to call it. And they email me every day looking for jobs. I was like, I don't have a job. I don't have an employer that that knows how to hire you. Many of them. And so just a cautionary tale around COVID. We really need to bring, as Rebecca said, all the stakeholders to the table. We can't talk about how we impact licensing in the healthcare space without clinics, hospitals at the table, being ready to hire. That's a really big piece. So as I said, yeah, we work in states where some of this legislation and this advocacy effort is happening, but in my day-to-day work, it's, as I said earlier, really sitting with an individual, figuring out, given this complicated process, what makes sense for them. If you read the article, I just want to throw in a little chapter 2. Yesterday, I met one of the doctors who was quoted in the article, who I've been working with for about a year, a wonderful young doctor from Ukraine, who was absolutely delighted to tell me the residency applications just opened on ARIS, and he has 2 interviews. So really, really exciting to be part of the process. These people are so committed to their practice and desiring to use their skills, to use their experience, to figure out the pathways. And so that's really challenging and incredibly rewarding to be part of that. I'll stop there.
Just really quickly on making it easier for license holders in the current system. There's a couple of things that we've seen in states. First, to kind of the foreign trained worker workforce. We worked directly with Colorado as one of our states, and they had a working group around expanding exams and offering exams in different types of languages. So that was one thing that we've seen in a couple states. One thing we focused on a couple different population groups, one being foreign trained workers, another being military families and especially military spouses. And pretty much every single state has enacted some sort of policy that it should allow it easier for military spouses to immediately work, or whether it's temporary or just immediately work in their licensed profession that they hold in a different state. But not many of the military spouses were aware of this. And they just would show up in a new state and assume that they had to go through the whole process again, or didn't even try. So a lot of the states realized this, and they started putting the information on the licensing websites, all over the state websites. They handed it over to kind of the military installations in each state, and that was like a pamphlet that was given as soon as families entered the state. So that was one kind of way to help work within the current system. We've also seen states look at eliminating fees, which I think Morris touched on, eliminating fees, especially for those people who earn, their earnings are below poverty level, because we know that fees tend to be a barrier. And then we also looked at people with some sort of criminal history. And a trend that we had been seeing in a lot of states is around predetermination. So essentially allowing someone to go before a licensing board and saying, before I go through all my training, my education, exams, etc., will my criminal history prevent me from ultimately getting this license and getting an answer before they go through the whole process. So those were a couple things that we've seen just working within the current systems.
Mm-hmm. I'm just curious, with that system for people, exiting the criminal justice system, have states been using that frequently, or are there some states that are doing it really well, where they're making that opportunity available, or I'm curious.
Yeah, no, that's a good question. I'm trying, I want to say Delaware was one of the earlier states. We worked with Idaho on creating that. Another, obviously, getting rid of kind of the moral turpitude clause was another one that we've seen over the last few years. I don't know exactly when in terms of.
That's interesting.
Tennessee created that law in 2017, I believe. I didn't see a single candidate propose something to the board in the meetings that I went to. I did see people with criminal histories appear before the board after they'd done all their education and had to answer for their criminal history. And in most of those hearings, really all but one or two, they were licensed. But I think that the way that those hearings felt made me understand why this may have a huge chilling effect. If not only do you have to undergo all that risk, but then you have to have this humiliating hearing where you tell the board about your driver's license charges from 15 years ago, and they act like they're not going to give it to you, and then in the end they do. It's a rough situation. I think it's a great law. I didn't personally see a lot of people taking advantage of it, but I may be wrong about that.
Morris?
Just wanted to add that Rebecca's work has really influenced our trend of research in that now we're looking at board records and seeing what boards have done. And we have a big database where we look at a large number of universally and partially licensed occupations over time and across states. And initially, we just started looking at statutes, but in the last several years, we've been able to get at board records and board minutes and looking at what boards are doing, since I think that's where the rubber meets the road. In terms of issues of ex-offenders, there's been some real changes in terms of, in the past, it was general reputation that allowed or didn't allow you to get a license. And now, did you commit a violation that's directly related to your occupation? So for example, you perhaps would not want someone who's been convicted of burglary becoming a locksmith, although who knows, they could be great locksmiths if they were a particularly good burglar. But there has been a real linkage between people, what they're convicted of, or if they're ex-offenders, and the type of license they're applying to. So there's been some very dramatic changes over time in making sure that what an individual did in the past is directly related to the license they're applying for.
That's really interesting. The next question is actually for all of you. Looking at how Minnesota can better address equity. As I mentioned in my opening remarks, we published an article recently showing or explaining some of the barriers that people of color face in obtaining a license and some of the significant disparities in that licensure. In Minnesota, we know that disparity is particularly significant, with disparities between Asian and white workers nearly twice as big as those that are on a national level. And there's a 16 percentage point gap between Latino workers in Minnesota and white workers in their licensure rate. And we know that this matters for a number of reasons, as we've been discussing this morning. But we know that workers with a license are better able to make higher wages than similarly licensed or similarly unlicensed workers in similar jobs. So this has a profound impact on people's lives. So I'm asking you all the really easy question is, as we look at these glaring disparities, how can licensing be more inclusive and start to address these inequities? And, if you can offer some ideas for Minnesota in particular, what is the best course of action for us moving forward on the issue of licensure?
So I actually don't think this is such an easy question, because the benefits of licensure are visited especially strongly on groups that traditionally experience discrimination. So what's very confusing about this research is everything you just said is true, which is there are fewer people of color that have a license, that it disproportionately impacts populations that experience discrimination negatively, but it also disproportionately benefits them if they get a license. And so there's all this research out there that says that, so I think especially if there's a felony ban, that for that profession, Black men see a huge wage bump and an increase in I think even employment. I could be wrong about that, in that area. And that research has been turned into a narrative about how this is the new, well, also because of that graph in the unionization and the licensure, this is the new unionization. This is the new credential that you get, your toehold into the middle class. This is the way that we're going to professionalize, from out of poverty into a good wage earning thing. And I'm skeptical of that research. Maybe you get not skeptical of the research. I think that I'm skeptical of that message being what should come out of that research, because that higher bump comes from the people who are disadvantaged. So what I say in my book is like, it's the costs and benefits of it are disproportionately visited on some of our more vulnerable sets of workers. And for every bump that you get from licensure, it's because somebody is left out. And so we ought not to think of, I'm kind of coming back around to where it's easy, I think we ought not to think of licensure as a great source of equality and equalizer between unequal worker power. But I do think it's a good reason to not give medicine a free pass. I think if we just hit the low-hanging fruit over and over with the hair professions, and then I think that's I've been thinking about the political economy of licensure, but also the political economy of licensure reform. And it bothers me a little bit that if we're really going to roll back licensing, a lot of oxes are going to have to get gored. And we start not with the doctors, but we start with the lower income professions. And so I don't know how to solve that politically, but I think that's worth thinking about.
I just want to echo that throughout our entire project, as soon as we kicked off this work on occupational licensing, immediately all these professions came in and said, well, you're not talking about us. You're talking about the occupation. You're not talking about the profession.
Yeah. You'll notice that I use the word profession, and most people here are using occupation. That's a choice I made in my book. I'm not, they're all professions to me. If you're a licensed, hair is a profession, doctor is a profession. Yeah. No free passes.
Just really quickly, one thing right now, the current administration and at the federal level, they are handing out a lot of money to states to work on apprenticeships. And I think apprenticeship to licensure is a great way to try and get more people into the field, mostly because it's a pay as you work. And so it helps to reduce some of those fees and burdens that might exist for certain professions. So just throwing that out there as one tangible example, possibly for Minnesota to look at. Utah, we've worked with Utah quite a bit, and they've been looking at competency. So not necessarily the hours on the seat and the training required to receive a license, but looking at someone's competency and how do you examine that in order to get them into licensure. Again, reducing some of those barriers. So those are just kind of two examples thrown out there.
Yeah. Just one other issue, when you talk to the people in the professions, they always view, well, we need to have the right number of fish in the pond. And generally these are the professional associations, and the professional associations are very much like a union in that they look after, which they should, that's their job, and that's who pays the fees for them to be in office, is to look after the economic and personal well-being of the people in the profession. One thing we find in terms of when our licensing laws pass, the dominant characteristic is whether a professional organization existed in that state. So they want to know, and they want to measure and make sure that there are the right number of people in the profession. So there needs to be, and getting back to some of the issues that Rebecca mentioned, is there needs to be more stakeholders at these professional meetings. So you need to have consumers and others who have a vested interest other than the professions that tend to dominate the boards, and the boards will oftentimes look at the National Association and say, these are the requirements, and these requirements tend to be ratcheted up. So for individuals to get into the occupations, it's much more difficult when the hours go from 1,000 to 2,000, when the requirements to become a physical therapist go from a bachelor's degree to a doctor of physical therapy. So these requirements are ratcheted up, and those have disparate impacts on lower income individuals. So going back to your question, that as these requirements are increased, and what you find when an occupation becomes licensed, the requirements are not that rigid initially, but the longer an occupation is licensed, these requirements become more and more difficult, and that these requirements do have disparate impacts on individuals in lower incomes.
So I would say, so like Minnesota has a great program to support IMGs through supporting, it's somewhat complicated, but helping discern who would be a good candidate for residency, helping support them through the process, get clinical experience, and then ultimately, I believe there are a number of residency spots. So it's a really great program to support international medical grads. But it's very limited in its scope and the number of people it can really impact. And I really am excited about the work that's happening to really say, if you've practiced as a doctor and you've done a residency and you've worked, you need a different pathway than a young person who just graduated medical school in the US. So to put them into that same residency program makes no sense. Obviously, we want our doctors to be competent. I love the competency-based work. We're looking also at some of the work in Canada to evaluate doctors. But if someone is a competent doctor, they don't need a 3-year residency necessarily. Maybe they need more of a 1-year apprenticeship or internship to understand how medicine is managed in the United States, but really a program that looks at who they are and what their experiences are. And I think that that's, really important. I will say for internationally trained nurses, the process to relicense is much, much more simple, straightforward. They pass an exam, they pass NCLEX, a national exam. In some states, they need to have their language evaluated, and there's just a much less of a barrier. So really thinking about what it is we're looking for and what's going to benefit our communities where there's such need for especially primary care health providers with cultural competency, with multiple languages, with experience in natural disasters and pandemics. This is what we need in the US.
Right. Well, I want to be mindful of time, and I want to make sure that we have enough time for people to ask questions of this knowledgeable panel. If you're interested, we have 2 mic runners in the back who will make themselves available to you if you want to raise your hand. Yes, if you look in the back, I see Kim and Tyler from the community development team. There's a question up here.
Thank you. I have loads of questions, but I'll stick to my first one. Because it was briefly mentioned about unions, and I didn't hear really anyone talk about how this work intersects the labor union conversation. And just curious if anyone has some comments through that lens on how labor unions intersect what you're talking about.
You want to do it?
Yeah.
Yeah.
Well, let me take a first pass, and others on the panel can certainly have a lot more to add. Certainly unions view licensing as an intersection, or that is that they work together. So oftentimes individuals who will represent nurses. The Nurses Professional Association and the nurses unions often work together, although there are times when they work at cross purposes. So it really depends on the situation. Also, teacher unions work very closely in terms of setting standards and increasing the requirements to become a teacher. Both of these, the professions are very interested in increasing quality, and for that means increasing standards. Both organizations, both members of the professional associations and unions, are very interested in making sure their members do well. So I think those are the incentives that are very important to both the professional associations and unions. I might add, and Rebecca alluded to this, I have in one of my papers a graph showing the decline of unions. Unions were about a third of the workforce in the 1950s. Now, overall, they're about 10%. In the private sector, they're about 6%. And you may remember from my opening remarks that licensing was 5% in the 1950s, and now they're 25%. In fact, if you added up all the people who are in unions plus all the people who are covered by the federal minimum wage, it's about half the number of people who have attained an occupational license, and much lower than the number of people who are covered by an occupational license. So those are a couple of, maybe this is sort of inside baseball, but the issue is attainment versus coverage. And a lot of laws cover what people can do. So for example, in engineering, only about half of civil engineers have attained a license, but what they can do is really covered by the legislation and by the board. So those are some complicated issues dealing with what unions do, which is collective bargaining, wages, and employment, but they're also can serve as a very important lobbying organization at the state legislature and before licensing boards. So those are things to look out for practitioners.
And I'll just say briefly, there's a paper by an empirical sociologist called The New Closed Shop that I know Morris at least knows quite well, and so do I, that is about licensing, and it calls it the new closed shop. And I think that this is very much the wrong way to think about licensing, and in my book I talk about why. I think that unionization is much more appropriately viewed as a kind of progressive, imperfect, and like the book is not about licensing, but there's lots of reasons why we might think about unionization as a kind of progressive worker rights kind of thing, and it's inappropriate to, for one thing, the whole labor law is all about getting these two people to the table, protecting rights on both sides, and going through the negotiation process. In licensing, there's no advocate, there's no pushing back for the consumer, right? And so there just isn't the same kind of regulatory oversight that there is for unions, and so that's one of the reasons why I think that they're pretty different.
Hi there. Thank you so much to our panelists. I've taken tons of notes. My name is Anna, and I work for a coalition of nonprofits that's in particular concerned about the way that occupational licensing has impacted individuals impacted by the criminal justice system. And we have done some work around the pre-clearance issue that Rebecca mentioned. Pretty quickly as we got into this arena, what we realized is that there's kind of a double tier of scrutiny for a lot of professions, where there's the individual licensing, and we have, I think, 26 different professional licensing boards that we are negotiating with around the individual licensing. But then a lot of our care facilities are also licensed at the facility level, and they're licensed by the state, and their state licensure is contingent on their adherence to a number of quite rigid requirements around excluding individuals with certain criminal backgrounds. So even if somebody is able to obtain the individual license, they may be excluded at the facility level. And I'm curious with the research that those of you up in the front have done, if just what's the state of research and reform at the facility level, and especially I guess my what we've noticed is that at the individual licensure level, our concern is mostly around lack of transparency, but at the facility level, it's really around rigidity and lack of discretion. And Morris, when you were talking about ensuring that someone is excluded based on a violation that is related to that occupation, we don't find that being applied as well at the facility level. So would love to hear what your thoughts are around those reforms at the facility licensing level.
Yeah, just one thing, and I don't know if this is analogous to the issues that you're dealing with. So for example, in restaurants are licensed at the facility level so that health, safety, cleanliness are examined by inspectors. But the people who work in that restaurant are not licensed. So the wait staff, the cooks, others are not licensed. So that may or may not relate to the types of issues that you're dealing with. On the other hand, certainly in healthcare, both the facilities and the individuals are regulated, so that doctors, nurses, and so on, as well as hospitals, are licensed. So there's a lot of variation across different industries in whether the facilities need to be regulated or the people who work in those facilities should be regulated.
I don't have much to add, except I know this isn't the only state that we've heard that concern before. Is yes, someone with a criminal history has made it through the gauntlet of the board, but then the employer, then they're struggling to get hired on. And I know there's national efforts around getting businesses to commit to hiring people with some sort of criminal history, but I don't have a solution for you, except I know that this, it's kind of universal, and we've been hearing it from multiple different states.
Yeah, I think a small part of the problem will be to eliminate that double thing. So like I'd like to see hair salons regulated more at the facility level, not the individual licensing level. So then you only have to go through, one. Childcare, I think, should be that way. Maybe license the facility, not the workers at it. Hospitals maybe will always have both. That's a tough one. I think we just, unfortunately, we don't have the solution. The solution is just to stop viewing somebody's criminal history as a qualification to work. Like that it's such an imprecise measure of whether or not you are a safe or ethical provider. And that's just going to take a lot of political work and work that you're doing, I'm sure.
Yeah, and there's been some dramatic changes from general good moral character, which was dominant in the 60s and 70s, to regulations on what did an ex-offender do, and is it related to their tasks?
Thank you. Justin Hollis, Wilder Research. A couple of comments, and I think that may morph into a question. It seems to me this conversation is about labor market intermediation, regulatory capture, and signaling, a la Michael Spence. My question is really about systems and outcomes. It was said earlier that these systems are broken, and I guess my question is to challenge that. Are the systems broken, or are they producing exactly the outcomes they're designed to produce? This notion about signaling, earlier you commented how for Black men, the absence of a felony was sort of a signal of skill, quality, and may result in greater economic success. And so there's some troubling things about the ways that signals work for workers depending on who that worker is. For one worker, it may be grease and it may be grit for another. So just wondering if you could address that.
I mean, I think you put it exactly right. The system gets the results it's designed to get. I think that's absolutely right. And to me, my focus, as you know, is on the self-regulation piece of that like the professions want control of the boards because they want to control the profession and the important piece of licensure in their own interest. And I'm also really troubled by the signaling hypothesis. And I think that the researcher that I'm talking about, who produced those results is also really worried about that as a signal, like, because we don't really give out criminal records in a way that's completely neutral in this country, right? Or really particularly indicative of your safety as a provider. And yet we double down on it in the licensure system. The thing that I think is really dangerous, and I think he would agree, is like the people who point to his research to say, this is why professional licensure is so good for, Black workers. And I think it's a risk of a misreading of his research. So I agree with things you're saying.
I might add, and that I think the researcher you're referring to is a co-author of mine,
Right.
Peter Blair, and his work, and it's tied into a lot of other research which fits under the general rubric of ban the box. So if that relates to applying for a job, and have you been convicted of a felony, or do you have a criminal record, and that those questions are not allowed. With licensing, that serves as a signal, as if you got a license, that means your record is fairly clean, and that kicks you up in terms of your likelihood of being employed, and it has a disparate impact on Black workers. So those are issues that he has looked at, and that licensing can serve as the equivalent of the ban the box items that are particularly important in the labor market. And he's, as was pointed out, and as Rebecca pointed out, that shouldn't be viewed overall, that there are other effects of limiting individuals in terms of ratcheting up requirements, which again has a disparate impact on low-income individuals.
Tamar?
So I think I'm the one who said the system is broken, and I think absolutely your comments are correct, and it goes a lot to what Rebecca was saying about who's in the room making these decisions about who gets licensure. And in a country where we are so short of primary care healthcare providers, where people know how very broken our healthcare system is, as consumers, patients, we know that the system is broken, and these folks that I work with who have skills and experience, along with all the multicultural knowledge and competencies, So I think it's a kind of a twist, but a willingness to say, in our desire to turn over the policing of the profession to those in the profession, we aren't looking at the broader good. So I think it's really, really so important to have these conversations.
And just to give a little color to this, I heard a professional board member say to another board member, she was concerned that they had relicensed somebody who shouldn't be licensed, a guy who had had sex with 11 of his patients. He served the inner city women in Memphis as a gynecologist, an OBGYN. He had sex with 11 of them and traded drugs with them for sex. Got his license back, and one of the board members, a public member, said, I wouldn't send my daughter to him. And the board member said, he only sees 10 care patients anyway. So, there's a systemic indifference to, like, the system is working to protect the kinds of people that the board members recognize as the public. And that excludes, I think, a lot of the public.
I think we have time for one more question. I see a hand in the back.
Hi, thank you, everybody. My name is Beth. I'm part of the Center for Economic Inclusion in St. Paul, and I am really appreciative of this conversation. I've learned a lot, and I appreciate some of the nuance I was just hearing around the conversation around racial equity and the implications around licensing. One area I'm still interested in learning more about is, I know especially in Minnesota, there's a focus on how do we raise wages for specific professions, like home health aides or CNAs. And there's sort of this tension I'm hearing, right, of licensure would increase wages for these groups, but we know it'll also exclude people. And I'm interested in, like, I understand some of the pieces that are more neutral to that maybe make sure that it's more of a public facing board and not, but I'm trying to understand, when you talk to advocates around this issue, what are some of the ways you would talk to them about the tensions or the complications or why we shouldn't be going that direction in trying to increase and professionalizing that profession in order to increase wages for a profession that is predominantly people of color in Minnesota?
A couple of, and relying on my occupation of economist, is that there are no solutions, only trade-offs. So one of the things that not very satisfying, but that certainly for individuals in the occupations, one way to raise wages and increase hours is to become licensed. However, that does result in people who pay for those services having to pay more and having less access. So there needs to be some sort of cost benefit, what economists call welfare analysis of these issues.
All right, well, I'm sure you all have a lot of questions still. As mentioned, I think Ryan mentioned earlier, we're going to have a lunch following the second panel discussion where you'll have an opportunity to sit and discuss these issues further. So just want to give the panel our thanks and a round of applause. Thank you so much.